So when it comes down to chair-based exercise in care homes, one of the best exercises you can do is pelvic floor. And pelvic floor is one of those strange things because of the nature of where it's located, it's very hard to demonstrate it. So if you're working with people with dementia, this sort of limits the number of people you can teach your pelvic floor exercises to. If they have comprehension, they have understanding, you should be teaching pelvic floor exercises. Pelvic floor, a good strong pelvic floor, is directly linked in with a reduction of falls in older people. So it's a good piece of work to be doing anyway. Other general bits. When I run the courses, I jokingly ask people, do men have pelvic floors? And the amount of women that seem to think that men don't is amazing. Men and women have a pelvic floor. Pelvic floor is a band of muscle that sits in your pelvis like a hammock that controls urination, and it controls basically feces going to the toilet. Also, it allows women, if they're still able to have greater sexual pleasure, and for guys to delay ejaculation. So you'll find the same exercises, believe it or not, under two different names. Number one, the pelvic floor for women. Number two, keys exercises for men. Pelvic floor exercises. You've got two different types of muscle. One is your fast twitch emergency muscle for coughs and sneezes. The other one is your endurance muscle, rambling around town. Want to wait when you go into a loo because it's absolutely disgusting and you're going to wait till you go home, so you're hanging on. So the way we work the slow twitch, the endurance muscle, is you pull up through your back passage like you're going to pass wind, pull up through the front like try and stop yourself going for a wee, pull up through the middle and hold for 5, for 4, for 3, for 2, for 1. You should still be breathing, I'm still holding, you can release if you want. And I'm talking at the same time. So I gently release that off. Then I repeat the process, pull up round the back, pull up through the front, pull up through the middle and hold for 5, for 4, for 3, for 2, for 1, gentle release. You can repeat that as many times as you feel you need. I usually insert that in as a rest period when I'm doing other chair-based exercises. So whenever I sit them down and tell them to have a rest, I do pelvic floor with them. The fast twitch fibres is more of a stronger clench. You can't break down the elements, everything is pulled up together. So if I've got comprehension, I normally sort of play a game where I'll use a certain word. It could be Bruce Forsyth. So whenever I mention the word Bruce, they have to come on up. So I'll be talking about some old game shows and I go, who was the host of that? Bruce Forsyth, wasn't it? And then they have to clench. And I go, but you know, he thought his career was over and then he was with Tess Daly and Bruce used to pretend Strictly Come Dancing. And that's why I'll pop that in. It mimics having to do a very quick contraction if you cough or sneeze, which is exactly how you want to work that element of the muscle. If you do nothing else with them out of these videos, try and do pelvic floor with the guys that have comprehension. It's a fantastic piece of work on its own right.